It is my distinct pleasure to introduce the Golden Consult Award to our own emergency physician. Congratulations, sir. Hey, what's the Golden Consult Award? Oh, he called the perfect surgery consult. What's the perfect surgery consult? Well, you can't consult surgery too soon or the patient won't be sick enough to need surgery, and then the surgeon will get mad at you. Okay. But you can't consult them too late or the patient won't be alive, and then the surgeon will be mad at you.
So in general, surgeons do have a reputation of being a little bit curmudgeon-y when it comes to dealing with emergency room hits or consults from the emergency room. That being said, there are exceptions, and many surgeons are actually very nice, as you can check out in the link for this video here. So most emergency physicians understand that there's an art to the consultation process in any specialty, but particularly for surgery. The surgeons really don't want to be bothered, and if you consult them too early, they're going to think that you're wasting their time. And surgeons in general are very protective of their time. They're very efficient. They don't want to be doing anything but surgery. And if you're calling them and it's not for something that pretty definitively needs surgery, generally they're not too happy. On the other hand, patients can get sick very quickly. There are intra-abdominal processes, appendicitis, or maybe a surgery complication where a patient has an injury to some vital structure like a ureter, and they can get sick. And so as you're observing that patient, making your preliminary diagnosis, if you wait too long, the patient can get very ill, and then the surgeon, of course, will be mad that you didn't consult them early enough.
That sounds hard to get right. Oh, for years, scholars have thought the perfect surgery consult was impossible. Really? Oh yeah, they assume the only two outcomes for a surgery consult was surgery being mad at you or surgery being mad at you for a different reason. Okay, so for a perfect consult, all you gotta do is consult them at the exact right time?
Emergency room physicians often get the bad rap of just wanting to clear patients, get them out of the ER, and turf them to one specialty or another. Other specialists will refer to them in a pejorative sense as glorified triage nurses. That's, you know, what is your skill? Being able to pick up the phone and call another specialist. On the other side of that coin, surgery has this stereotype or persona of feeling superior to all the other specialties. They're, after all, saving lives every day, blood and guts in their hands, and intervening in a medical surgical emergency, taking someone who would have died and literally saving their lives. To that end, they don't want to be bothered by anything that is not essentially a life-threatening emergency, and can have a reputation for being angry, having a short temper, and having a very little patience for having any conversation with anybody that doesn't directly relate to doing surgery and saving someone's life.
Oh no, the consult length has to be perfect as well. What does that mean? Well, if the consult's too long, the surgeon will lose interest and tell you that it sounds like the patient should be admitted to medicine. Huh. Okay. But it can't just be a one-word consult like we give to ortho.
So that's not untrue. So internal medicine and all of the medicine subspecialties, nephrology, neurology, these are very cerebral specialties where every single detail of the patient's case has to be poured over to determine if it has relevance and how that's going to affect their treatment. Whereas with surgery, you know, they want to know the disease process, the organ that's affected, and how can they cut it out to make it better. And on the far end of the surgery spectrum, you have orthopedics, who essentially is the most Neanderthal of the specialties and can't process more than two-word consults.
Broken bone.
Which is wildly ironic because all of the orthopedic surgeons had to be the smartest people in their entire med school class to match into a very, very competitive orthopedic specialty. And then the second they start or finish their orthopedic fellowship, they forget everything about medicine except broken bone.
How many times has this award been given out? Oh, this is the first time.
Thanks for watching. I hope you found this educational and entertaining. Please share with a friend, and please like and subscribe.